Dr. Narendra Singh Verma will be talking on EASYTOR, an easy complete toric solution. Dr. Sriram will be the discussant.
Thanks AIOC, ARC and Kerala Ophthalmic Society for this opportunity. I present to you EASYTOR, an easy complete toric solution which we have developed in last 3 years. Not moving. Slides not moving. Okay. It's okay. So EASYTOR, an easy complete toric solution. So during cataract surgery, there are two ways to decrease corneal toricity: by toric lens implantation or by incision on the steep axis, which may be SICS, LRI, OCCI, etc. So EASYTOR has all important features which are required for preoperative workup and intraoperatively for toric lens implantation. It measures non-invasive tear film breakup time. As a topographer, it provides keratometry in 3, 5 and 7 millimeter zone. 3 millimeter zone is important. It provides axial heat map, so you can find out the nature of astigmatism. It should be regular. It has having manual image guided system, an app for the easy and error-free marking of the axis of alignment of the toric lens. It is having easy and error-free steep axis marking for surgical correction of astigmatism by incision. So EASYTOR also provides some new features. It is having directly access to the Barrett toric calculator and Barrett Universal 2 formula. So it prevents transcription error, and it is a fast method. So you don't know to fill all the data. It will directly tell you the readings. It is having real-time data sharing to the multiple device by Wi-Fi. So surgeon can analyze the results when he is in OPD or in OT. There's no need to go in the examination room. So let's see how it works.
It is a topographer with many additional features. It provides an easy, efficient, and economical alternative to existing solutions. It is an LED-based anterior surface topographer which analyzes 600 data points in a 9mm central corneal zone. A single capture provides us with all the required data which is summarized on a single screen. It provides keratometry in 3, 5, and 7mm zones, axial heat map, white to white, etc. Demonstration of toric lens axis alignment. Left eye keratometry of this patient shows 1.5 diopter astigmatism in 132 degrees in 3mm zone. Press the calculator icon. Net astigmatism will be displayed directly from Barrett toric calculator. It is 1.1 diopter in 145 degrees in this case. Enter SIA value, which is 0.3 in this case. The axis of alignment will be displayed automatically, which is at 147 degrees in this case. Press the pencil icon to enter biometry data: axial length, ACD, and lens thickness. The axis of alignment at 147 degrees is displayed as a green line, and site of incision at 136 degrees in the form of a pink highlighted area. Identify two prominent limbal structures. Click on it. The system will display their axis. It is 17 and 50 degrees in this case. Save the picture, rotate it as needed, and use it intraoperatively to identify landmark points under microscope. Here I am making two landmark points at 17 and 50 degrees on the patient's eye. Hold the degree gauge and align it with the markings. Now mark the site of incision, which is at 136 degrees. After lens implantation and viscoelastic removal, bring the degree gauge again to mark axis of alignment on the limbus at 145 degrees using 17 and 50 degree landmark points as reference. You can also mark the axis of alignment on the cornea. Finally, align the toric lens axis with the corneal markings. SCA marking module can be used for surgical correction of astigmatism using incision as a plan B in patients not suitable for toric lens implantation. Demonstration. Right eye is pseudophakic and post-op residual refractive error is plus 1.5 spherical with minus 3.25 cylinder. Even though the IOL power was perfect, the site of incision was incorrect as it was on flat axis. The left eye has cataract with 1.1 diopter cylinder at 175 degrees. Press the pencil icon to enter biometry data in Barrett Universal 2 formula. Then click the calculator icon to get IOL power options with residual refractive error. I planned for 5.5 millimeter main incision at 175 degrees and 2.8 millimeter OCCI to neutralize the 1.1 diopter astigmatism by using incision. Identify and mark two prominent limbal structures which are at 14 and 168 degree in this case. Intraoperatively mark the same points on the limbus using marker. Using these landmark points as reference, I mark the site of incision at 175 degrees on both sides. After lens implantation, a 2.8 mm OCCI was done and the main incision was extended to 5.5 mm. These are post-op day 1 and day 6 pictures. Post-op day 6 SIA was 2.6 diopter and 2.1 diopter on day 17, which demonstrates a regression of 0.5 diopter.
Thank you for your time.
What is the display that you're using when you're working on the surgery, on the microscope?
You can use a tablet, you can use the any device. You can use a tablet, laptop or desktop. It is connected to all the devices, multiple devices you can connect with it.
But you don't really need a tab. You can take a photograph, paste it on the wall, and then use that as a reference marking also.
No, when sometime what happens, you can take the tablet with you in the OT. After putting, when you have put the lens, toric lens, then you see which structure you are able to see and which is there in the topography picture. You will tap on it, it will tell you this is the location. So you mark this point and you can just, these are the reference marks. So, yeah.
The beads, the colorful beads.
Colorful picture.
Beads.
Those are the LED lights.
So these are the LEDs. It is LED based system like Cassini, but we are having different
Now
software.
we'll come to the most important part. This heats hardware and software.
No,
what is the
we
cost?
have developed, madam, we have developed this topographer. Since last 3 years, we are developing this topographer. This is our third model. We developed this topographer.
No, we'll have to come to...
It's very risky to put toric IOL. People pay so much. It's very risky. You get some error.
No, there is, so it will measure the axis of steep axis and
We have come to the most important question. There's hardware and software involved. What is the cost?
sir, we are developing two more things in this system. That P2 with infrared light, we will find out the total TK. We will find P1 and P2 and SDR mode too. So we can, the blood vessel will be more prominent. So after that, we will, everything is not, we are very much, हमको पता लगेगा बिल्कुल एक सब कुछ ठीक है, कोई एरर नहीं, सब कुछ इसमें है. और इसमें अभी जो है ना वो NIBUT टीयर फिल्म ब्रेकअप टाइम भी उसमें आएगा. सब होने के बाद उसको लगभग नेक्स्ट ईयर लॉन्च करेंगे. So it is under development.
Thank you.
Maybe 5 or 6. Thank you, sir.
Thank you.
Thank you, sir.